button you have to push, and we're on a new page this time, so it's very confusing for all parties, mostly me. So let's make sure that it's actually going live. Oh, I love that, Lisa. Thank you for updating our audience.
And there's two. I don't know why it's double, but that's fine. I don't know. Whatever.
I don't know. Hi, Peter. Oh, let's just make sure it goes live on the actual.
What's up, guys?
Da, da, da.
No?
Oh, there we go. It's working. Everybody heard us be confused for a few minutes. That's
my
good.
God.
That's good. All right, here we are.
What would the show be without some technical difficulties, Kat? This
Well,
is
no.
a
So this is
budget
our first.
operation.
This is our first show on our actual page. This is no longer on my personal page because we got enough followers that we could actually be legitimate. So it's very exciting. So here we are. Here we are. Okay. So here's what we're doing today. Probably. Not totally sure. But we're actually going to talk about real news that happened. Probably.
Wait, who are you? Who are you? Who are you and who am I?
Oh yeah, that's right. I thought I changed it so it was going to have our names. I'm Kat McDavitt.
I'm Lisa Berry.
Okay, we'll tell you who else is coming. So that's fine. So we're going to talk about some real news and some things that happened. It's very upsetting because Lisa sends me all of my news in the week and mostly analyzes it for me, and she was going to do that live on the show, but we run out of time every week, so we're going to do that first. We're going to have an update to our CTO conspiracy. It's very exciting. Carrie Pykowicz received an anonymous call in her voicemail that we are going to be sharing on this show. It's very exciting. And then we have a real live guest who does real things. Neil from Pear Team is going to be coming on and telling us about how he's like actually succeeding while everyone else seems to be like going out of business. Fantastic. We're going to have two awesome people talk to us about the Realness Project, which is a very cool program helping individuals who are justice involved reintegrate into communities, reduce recidivism, all these things. And then we're going to have very special guest, Peter Sharosh, who is raising money for pediatric cancer, again, through running a ridiculous number of miles to raise money. So very exciting. So Lisa, why don't you kick us off with actual news?
Yeah, I mean, I think you actually had some actual news yourself because you were at the Springboard Gala, right? You were part of that. So what I was thinking about going into this, I was like, hey, I just remember that still no money goes to women in health tech. Wow, that really sucks. And then I remember that you were actually there with Leslie, the real and very amazing CEO of Inzenna, to celebrate Springboard. So you can talk about that. What happened there? Did you get any gossip, any news? Yeah. Oh, okay.
Yeah. So, I mean, the big stat that was plastered all over the place is it's a 2022 stat, I believe. It might actually be, maybe it's updated, but it's from PitchBook, and it's that 2% of investments kind of globally across sectors in the US go to solely women-led companies. So, like, doesn't count if your co-founder is a woman, but like if you are a founder of a company and you're a woman, you get 2% of venture capital. Congratulations. I actually don't know what the stat is for our industry, but I can't imagine it's like, I can't imagine someone tacked a zero on the end of that.
You think it's more than 2%? I'm going to guess it's less than 2%.
I don't know.
No offense to our lovely upcoming guests who I believe do not identify as women, but
we never know. We don't assume.
We never know.
Yeah.
So that's a bummer. That's a bummer.
It is a bummer, but I like Springboard, and I like a lot of these organizations that like try to change the number. So that was good. So it was a really good event. There were lots of cool people there. I think I've said on the LinkedIn, I'm advising a company through Springboard as part of their digital health council called CuriDX, and they're doing really, really cool stuff. So I'm excited to share more about what they're up to. So hopefully we're changing the equation a little bit. It's good to bring awareness to those things. And then, the other thing, it's great that we have like an actual venture funded company to talk to us in a little bit here. The other thing, so Leslie and I went to that event and then she went off to Dallas to the MedCity Invest event down there. And what she heard at the bar from a bunch of investors was that they said that, they don't have as much money to throw at digital health companies, but they aren't getting pitched a lot. Apparently they aren't getting pitched a lot right now. Now, I don't know if she was talking to some like low end, like bottom of the basement venture capitalists. I don't know who she was talking to, but the advice that they gave her was that if you have companies looking for investors to pitch them now and not wait till January. I guess that's when everybody does it. I don't know. I don't know. Might not be
Interesting.
true. I don't know.
So the other thing that I wanted to talk about was there's a Bessemer report on sort of the state of health tech, and they were really clear. They were actually on a great podcast with Hallie Takeo, who was sort of talking to them about the state of health tech investing in VC and broadly. And first of all, they said they totally 100% conflate health tech with digital health. So, argue in the comments if you agree or disagree. But they were like, we're just using health
That's
tech.
why hashtag both.
We mean everything. Hashtag both, but also that's why our talk show is called the Health Tech Talk Show, just to be clear. Like, we obviously were at the forefront of that trend, no doubt. And I think that,
Yes.
is it the
It's
same?
totally
Is it not
planned.
the same? Whatever. Totally planned, totally planned. But their report is really good. And it talks about sort of where we are in the hype cycle of health tech and how definitely there's been some cooling off. And for me, and probably for you, because you're like more of a real business person than I am, like, that's when you get really exciting work done. Like, that's when you could actually say, okay, no more like ridiculous bubbles, whatever. They talked about down rounds, which I think is one of the most entertaining pieces as well, because, right, okay, you got, let's say you started your company in like 2019, 2020 or earlier, and you got this big, huge valuation. People were they're like backing trucks of money up, just like, take the money.
Absolutely.
And what that means is that you have this huge valuation that says like, you're worth $70 trillion. And it's like, okay, but you can't maintain that as like things sort of fall apart, right? So you have to say, let's get a realistic valuation. And they were actually saying, like, please take a clean down round over a complicated and messy and like dirty round that doesn't devalue your company in fake money. And I thought that was really interesting and probably good advice, but like, you have to convince everyone, like, it's okay that we have a down round for our company because we are like still building something of value. Like, we're not like, it's not like a paper tiger. It's not this ridiculous thing. We're actually trying to do something to actually like help patients and people and the healthcare system. So that was an interesting piece from their report. It's really good. The Bessemer like state of health tech, we'll link to it. You can find it if you Google it or whatever. But it was a
I
good
love
sort of
Bessemer
summary
is
of
my
where we are
favorite.
right now in health tech.
It's
They're
true.
really
They're
good.
my favorite
Yeah,
investor.
quality,
So they're the reason that I joined Collective
quality.
Medical, because I was like, oh, I just love them so much.
Mm.
Mm. Yeah, it wasn't the reason I stayed, but
Yeah.
whatever. It's totally cool. The thing I loved about that report is, so I hate B to B to C, like, bleh, like right when someone tells me that, I just want to
B
like
to B to
vomit,
C, B
right?
to B to C.
Yeah. It's like, oh, we're selling a wellness program. It's going to save America, and I'm like, oh my god, like I have a hard time with it. And then D2C, I hate D2C. Now I know that they are conflating digital health
Yeah.
and health tech, so we probably got some like weird digital therapeutic stuff going on in there, but they were like,
In the background here.
what is it, like negative 65% or something like that? Like, it's something really bad in that report. So I was like, yeah, well, hopefully we don't have to like hear from
D2C,
them very much.
like D2C is not like I understand, right? I have a background in marketing and growth from like all different kinds of software as a service companies. Like, I've been down this road before. I understand the simplicity of D2C. You love that feeling. You're like, we're going to sell something directly to the customers. I get it. But it is not a good business model. They were also talking, I read something else recently about like like all of the like single consumer brands that sort of cropped up in the last couple of years, how they're all like dead, like Blue Apron, like all those other ones, like nobody buys them, nobody cares. They can't actually like maintain like a vertical business by themselves. And that's not even in healthcare. Now you're talking about healthcare, like, yeah, people are going to pay for this. No, they're not. No, they're not. I'm sorry. They're
Yeah,
not going to. They're not.
I'm like firmly in the
Tell me,
camp. I feel like we've
give
talked
me
about
one.
this.
Give me one. Give me one. Give me one
I'm
that's
not going to
working.
give you one. I'm firmly in the camp that patients are not consumers and like go away. Like, why are we
Yeah,
even calling it
I
D2C? Like,
agree.
patients are not consumers. They don't
We
buy like
agree. We
regular
agree.
people
This
because
isn't
they
even
live
a
in a
debate.
weird. Yeah. Okay, it's fine. We won't fight about it. That's fine.
This
That's
isn't even
fine.
a debate
That's
because
fine.
we agree. Like, patients are not consumers. Evidence by a million things, including my inability to get a freaking price for my stupid eye surgery. Right? Like, impossible. Like,
But
impossible.
I bet we could draw a chart showing that it would work. Like, I bet we could
Oh
show a chart.
yeah,
Just,
totally. By the way, that
I love it.
advocacy organization, Power to the Patients with Fat Joe about price transparency, and they have a bunch of other people. Great, amazing, amazing videos. They have a new one called like uh, pricing is not estimates, and it's just about if you went to like every store and you're like, I'd like to buy coffee, how much does it cost? And they're like, well, the estimate is like $10 to $100,000. And then you're like, what? And that's
Sounds
exactly the
right.
healthcare experience. They're doing amazing work. I love them. Lobbying is what it is, but they are doing incredible work bringing attention to pricing is not estimates, price transparency. Patients should know, but it's an uphill battle, right? Because patients are not consumers in our system. The end. They're
No,
like the
no, it
bottom of the.
ends.
Yeah. So
Yeah,
that's my rant
yeah,
there.
yeah.
But Bessemer report, check it out. It's really good. I'm optimistic about the next 6 months to year and a half for health tech.
I'm
Like
not.
some of the fluff
Nope.
is gone. Come on, Kat. Some of the fluff is gone. It's time to
Listen,
build.
I'm always
To
ready. I'm
quote
ready for
the
the long
worst
cold
person
winter.
in Silicon Valley.
I've been ready for the long cold winter since like 2012.
Great. Well, hopefully it never comes because I'd like to see you frustrated there.
Yeah, well, it's been an every year thing. You've never seen me win, so it's fine. Just wait, just wait, just wait.
Keep losing.
Um,
Keep losing.
yeah, I'm a great loser. I fail exceptionally well, so I'll let you know how that
Yeah.
goes.
Huh,
Um,
great.
Other thing, so Support Act that was in the news. I care very much about solutions for the opioid epidemic. So it's kind of a bummer. It was not even on the table really to be re-upped.
Right.
But I also get the argument, right? It didn't work.
Well, I mean, that's a tough
It didn't
one to
work.
say, right? This is a constant thing when you say like, oh, why didn't the program work? Oh, because it was cut, because it was undermined at every turn by Congress, by the incumbent parties. Like, I get it, but like, if we made a real effort, I think we could do something real. The problem is with everything around opioid use disorder, behavioral health, anything else, there just are so many weird, ridiculous stigmas still in place, right? Why, for example, do we not have like full and free and clear and obvious access to medication assisted treatment? I'll tell you why. Stigma and weird moralizing when it's actually best in class treatment and we know it actually
Mm-hmm.
works. So it's hard to say it didn't work if like part of your plan was like, let's cross our fingers and hope that everyone just does the right thing. Like that doesn't work. Of course not. But we have things that
Yeah.
work. That's what pisses me off. We have things that
There
work.
are things that work. It's obviously super complex, and I feel the same way. Like it probably did some good things. My earring just fell out. It was very heavy. We'll pull
Uh-oh.
the other one. Too. So I think there were good things in the Support Act. I think it was useful for a lot of reasons. I think some people took advantage of it and did stupid stuff, right? That wasn't useful
Totally.
because you can make money that way. But I think it's a really complex problem. Obviously, like we're dealing with humans. We're dealing with a terrible, terrible drug that rewires your
Right.
brain,
Right.
and
Right.
there
Right.
are like regional differences to stigma, right? Like, so working with those communities in West Virginia,
Totally.
it is a very religious community, right? There is stigma. But then, there's also organizations that kind of exist outside what like current best practices are that are trying to innovate and they don't get reimbursed, right? Because they're doing different
Right.
things. And
Right.
so,
Right.
it takes like, if I could do it, if I could make a law, right? I would do something that opened up options for innovation a little bit more effectively than just like grants and things like that. But
Yeah.
I don't know, very complex, disparate problem.
Did you realize that like both of us are wearing black? I'm wearing like this weird
I
turtleneck
noticed
thing
that
and you're
earlier.
wearing black.
Yeah,
And also
yeah.
like our cover image for today was like Barbie colors and we are like the exact opposite of Barbie colors. We're
That's
like
such a good
complete
image.
like we're like
Okay, well,
boo, everything sucks.
this is a great transition, Lisa, because our other special guest is wearing the exact same thing.
Also
So
wearing
welcome.
black. Dr. Emo.
Oh man. But
What's
you know what
new?
I brought?
What's new?
You know what I brought? I brought my Ruth Bader
Amazing.
Ginsburg gavel
Amazing.
of
Oh shit.
truth to kick this off.
Oh
So
my
that's
gosh.
Oh
the
my God.
Okay.
so
Well,
let's
Carrie, so Carrie Pie Coach, conspiracy collector, very important person who knows a lot of things from the dirty underbelly of health technology.
Mm.
So on one of our last episodes, she gave us, I'll let you give the high level, Carrie, and then we'll go to this update that you have.
Of course, of course. I'm all about the hot goss at the federal level, the state level. And as you know, I formerly worked for the state of Alaska and Colorado. And I still get a lot of calls, phone calls. I travel a lot. So I'm on the street, kind of hearing and listening to what's going on. And it just kept servicing that there are some kind of drivers at HHS level and somebody's calling the shots, but there's no one in this chief technology officer role. It surfaced at HIMSS, it surfaced at the Area for State Territorial Officials, ASTO, which was in Chicago. And so, as does any sane person, you map out all the connecting, potentially correlating factors. And we all know in science that correlation does not equal causation. But for this, we're just going with it. We're digging into the conspiracy theories. And so,
It
mapping
could,
out,
though. It could. We don't know for sure. It doesn't
it,
necessarily equate to causation, but
I
you
feel like
never
we're getting
or
know,
closer.
right?
We're getting
You
or
never
closer.
does
know.
it? Or does it?
Or
But
does
you
it?
look at
Or does it?
stars and the moon, the tarot cards. We thought maybe it could be various sweethearts in HHS and CMS, like Tom Novak
Mm.
and Jess Khan.
Oh.
No, no, that didn't pan out. It's one person. It seems to be resonant, and you know, in peeling this back, thought, could it be Kim Kardashian? Could it be Anish Chopra, the former White House assistant to the president and technology officer? I don't know. So I threw this out there. Fun, wild idea, lots of yarn. Thanks to Melissa Danino, who will be on talking about actual things that she's working on that are helping people. But surprisingly,
This is also helping people, I feel like. Just saying. We're getting
This
to
is
the bottom
helpful.
of
we're
a
getting to the bottom of this.
long-standing potential
Um,
thing that's happening.
and there are lots of government, non-government mistruths. So let's dig into them. Let's be the mythbusters of that. Like for example, there
Mm.
was a Sasquatch spotted in Colorado on someone's phone. So clearly it has to be real. But that
Oh.
aside, I received whilst traveling a phone call earlier this week, and I would love to share that with everyone on the call or on this TV show with a tip about who or who isn't this shadow chief technology officer. So, with the science and magic of the internet, let's try to tee up the audio file. We have
Let's
protected this audio file so that they can remain anonymous because I don't give away my inside sources. So,
Mm.
all right, all right.
Very
Let's
ethical.
see if we can take a listen here.
I don't know.
Hey
This is
Carrie,
hard.
calling regarding the claim of a shadow chief technology officer for HHS. Hey listen, this role is critical. I can't speak to the Kardashians being involved, but I do admire Niche for his service to this country during the Obama administration as the assistant
serious.
to the president and chief technology officer. But I cannot confirm or deny that Anish is acting in an unofficial capacity as the HHS Chief Technology Officer. What I can say amongst all the political drama is HHS should fill this role and ask smart people like Anish, current and former national coordinators for health information technology, starting with Nikki Tripathi, and talking with Don Brucker, Karen DeSalvo, talking to all sorts of people. Someone leading the helm would help accelerate HHS's vision and mission, but with the shutdown likely happening in November, I'd wait until after holidays to recruit. Plus, it gives Anish more time to serve as the CTO. Oh wait, please delete that from the recording. Delete. Like I was saying, HHS needs to fill.
I mean,
you heard it first. Is that science?
Draw your own conclusions, everyone. This is just a source that, we are protecting, Carrie is protecting. We just, draw your own conclusions.
Yeah.
Make your
So the silver lining of this, one takeaway is public service matters. I want to get Anish on the show so you can talk to him directly.
Yeah.
Or if there is a strong woman out there calling the shots, we want to know who that woman is and bring her on so we can get to the bottom of this and promote their ideas. Like with all the generative AI policy turmoil, somebody's got to be leaning into to HHS. So that is all I got. But again, door is always open to talk about hot gossip, real, unreal, conspiracy theories. I'm here for it.
Yeah. Kat, we have lost your audio. I'm sorry to tell you. Tragically.
I had to put myself on mute because I was laughing so hard. No.
You're back.
So,
You're
Carrie,
back.
I mean, I don't know if I told you this, but we are currently coordinating schedules with Anish so that he can confirm or deny this rumor. And I'm not sure. So
Let's
it's going to
see.
be in a couple
Let's see.
weeks. You know, he's a busy man, being potentially the shadow CTO and having his real job at the same time. So we'll see. We'll see.
Yeah.
All right. Okay, Carrie, thank you very much.
Incredible,
We're going to move
Carrie.
on.
Thank you for your service. Oh my God.
My pleasure. My pleasure.
Just wanted everyone to make sure that we started this out with some laughter. All right. So, Carrie, thank you very much. We're moving on to our friend Neil. There he is. We didn't test his audio.
All right.
All right.
There we go.
There we go.
All right.
Yeah. So Neil, I told Lisa about you like a couple weeks ago because we didn't really know what we were doing with this TV show, and we have a Google Doc where we randomly write down cool companies we've met. And I was like, I met this guy. He seems pretty cool. Community health, Medicaid. And she was like, you should invite him on the show. And so here you are. But it was after you announced your pretty, very respectable news about your current round. So introduce yourself. Give us the dirty dirt, and talk about saving America.
Totally. Well, I'll say I'm definitely not as cool as a bald eagle on fire with a mountainscape behind it in the corner here. So expectations.
Oh, we should have moved your photo down to that side. Yeah, so that's the prime spot.
It's nice to meet everyone. My name is Neil. I'm an engineer by trade. Before that, just a kid from India who thought to be a doctor and made my way to the US, found bits and bytes. So same mission, but different career pathway in healthcare technology. And yeah, we just raised a Series A round in Medicaid. So what we do is our mission is to we help to connect underserved communities to high quality care as a mission statement. Folks were, as we've like gone through and talked to folks about, the reporters about the raise, and they ask us about competition. I'm like, we can't have too much competition here. Like, please, more of it.
Please,
we need more venture funding.
And care about Medicaid, please.
Yeah. But in a quick nutshell, I'll give the very brief overview of it. And it's been like any path to product market fit, it's been meandering. We've been around for about 4 years. We've only been really doing what we're doing now in the past 2 years, which is there's a series of regulations that are all trying to promote community-based care models. Engage hard to reach patients that aren't getting preventative care. They're not going to the primary care clinics because an individual Medicaid just has so much to think about. There's so many things in their lives that don't have to do with their care that they have to think about first, right? Housing, food, transportation, picking my kids up from school. Like there's just a million one things. So they're not going to the doctor's offices, but they are going to community-based organizations. They're going to social support organizations, shelters, food pantries, sobering centers, et cetera. And the insight was, well, why don't we enable them to become sites of care? In a very, and let's help them get care delivery at these community-based organizations. Let's give them new funding streams so that they don't have to purely rely on grant funding, and they can take those dollars and reinvest it into themselves, reinvest it into the community. And hey, guess what? All these individuals have a ton of trust that's already developed. We're not trying to just be a robocaller who calls in and says, hey, have you done your annual wellness exam today? Who the heck are you? Right. And so we're saying, let's go to those organizations, let's upskill them, let's give them tooling and training, and let's give them access to a wraparound medical group, which is Parateams Medical Group. So, started that with my clinical co-founder, Cassie, who we started to work, we worked in the trenches at Forward in the early days. Here we are. And now we're using the capital to grow and expand and take the model and expand it nationally.
I think that there's just really not enough, like you said, there's not enough focus, not enough innovation, not enough people trying to actually solve problems on the ground of people who receive Medicaid members, or the providers who are like, okay, I guess it's all coming through my door, and I maybe have to take financial risk for a population who have no resources to support. I have no time. I have like less than 7 minutes. So with every patient, if that, and like it's almost impossible problem that's being pushed down to the providers on the ground, primary care, pushed down to CBOs who receive even less money, and then of course pushed down day-to-day to patients and Medicaid members.
Yeah, we spent the first 2 years, by the way, at least you're 100% right, trying to enable provider organizations and get, even a little bit of attention there. And there was just no behavior change. Like we couldn't, and it's not pointing a finger at anyone. It's the fact that they just are overburdened.
How?
That's it.
Yeah.
How are you supposed to do that? And instead, we're kind of shifting gears and saying, well, let's upskill and retool community-based organizations. Really, they've already been doing this stuff, right? Like they've already been a
Right.
part of the healthcare system, whether they recognize it or not, right? And it's just
Right.
they've just been unrecognized in all of it. So this is us saying let's formally recognize them. Let's take the financial chassis that are now coming down through these new regulatory programs, and let's help them get involved. California had this big regulatory program called CalAIM. It launched in 2022. That's kind of our first market there. And they just released a report after 2 years. They have less than 5% of community organizations participating in any of these programs. It's sad, but also not a shocker. It's kind of like, these are these organizations, and it's the top 5% by grant funding, right? So the most well-financed are doing this work. And we're saying, well, we might not be able to get to 100% there, but we can definitely beat 5%. We can get, 15, 20, 25, 30%. How many of these organizations can we actually get to participate formally in our care delivery system?
Right. So I always think about like, hey, in other countries, like they fund social services in different ways. They don't try and push everything through one healthcare program, which is Medicaid. And obviously, like, it is what it is. We're not going to change that part of the system today. But, how much do you think it matters? And what are the biggest levers for you all? Are you thinking we're focusing right now on any state that has a meaningful 1115 waiver to do interesting stuff with Medicaid, or any state that has, forward-thinking Medicaid managed care organizations who have an expectation from their state that they will also do this stuff? Those are the biggest ways that I know that this innovative work is happening, is waivers and like MCOs who are required to do something in this area.
Totally. So you said something really interesting, which was like the how does this look globally, right? And there's a great graph out there that shows, yeah. It's like the OPEC countries, for every dollar they spend on healthcare, they spend like $2.50 on social support services. And you know what I'm going to say next? The
Wow.
U.S., we spend $1 for healthcare. We spend about 90 cents on social support services, right? So like,
that's more than I thought. That's more than I thought.
That's more than I thought. But like therein lies this big discrepancy, right? So you nailed it. By the way, Lisa, it's a pleasure to meet you. By the way, never met.
Nice to meet you too.
Serendipitous meetings.
Oh yeah. So yes, we do exactly what you just described, which we go in off the 1115 waivers. And so California had being one of these vanguard states, they had a massive 1115 waiver called CalAIM that launched in January 1st, 2022. So, we're about 2 years into it now. New York has one coming up, and now there's these slew of waivers dropping down across the country. Right. All at the direction of CMS. And what more interestingly just happened is a woman named J.C. Cooper, who was California State Medicaid Director, is now moving into CMS to oversee 1115 waiver design. And I remember sending a note to J.C. Cooper. We never met, and I was just like, "Hey, this was an amazing program. Like, here's some testimonials of like from our patients because of all the work she did on California's 1115 waivers. It was her baby." And so I am very optimistic that we're going to see more of these types of programs coming out, and with real dollars backing it. And we're in this phase of let's just get these community models implemented first, a couple of years of that, and then a couple of years of let's see the impact. Let's establish the ROI of all of it, and then hopefully that'll start just having a snowball effect across the country.
Yeah, so what I love about what you're doing is you're like using humans, right? You're not just like, I have a technology platform and it will show you things on a dashboard.
AI will solve my CBO problem.
We will lift the underserved up and they will be whole. Like, it's not just that. It's like, oh, this is actually hard work. And we're working with organizations that know people and have been doing this forever. And we're like just utilizing them better and adding more humans in who can help other humans.
Totally. I mean, I'm super skeptical of the, especially with Medicaid and the engagement that's pure technology. Like, don't get me wrong, there is a role to be played, but now we're like, we have all that stuff implemented, right? Like we have blast out text messages. There's been some great companies that have come before us. Like, don't get me wrong, like Impulse, amazing company, came out, worked with
Love
plans.
texting.
Way better than what was there, right? But now we're trying to, like, what's the next level here? And like, there's nothing that beats the support that you have over the phone. Largely in this bucket of like talk therapy. For a lot of the patients that we work with, we're the only support system they have. They just do not have anyone else to lean on here. And so when we can come and we can show them that we will always show up. Number one rule of social work, you can't care more than the patient, but if they invest, we are right there with them. Right. And so if, any time of day, like we've had, we've had some insane stories that, individuals who've had, go cold on us for 3 months. And then we realize that they've been in, some sort of abusive relationship and almost been kept, locked at home. And then they come out and we're like, okay, we can help get you support. And we're one of the first people they call when they do that, because they know that we've always been there for them. And so those are the stories that really stick with you, as we're doing this work. We are, there's no one else there for them, unfortunately. Right. And so we want to be the ones that'll always pick up the phone if they're there, and we'll be lovingly persistent, as Cassie calls it, my co-founder. And just show them that we're in their corner. We're here. If they want to, help get connected to one of the organizations that we're partnered with, we're going to help them along every step of the way. We'll help do, interview prep for shelter organizations, right? There's like all these, when you're trying to just make ends meet, you're not thinking about, well, I got to go to the shelter, I got to prepare something like that's going to drastically increase your odds of getting accepted. And you bet we're right there with them, helping them, talking them through it all.
Filling that stuff out. Yeah. There's so maybe you can just opine a little bit. You guys are early, relatively early. You've been around for a while, but you're early in this fundraising and this current, pivot and path that you're on right now, which sounds very promising to me. One of the takeaways from that Bessemer report, and then some of the takeaways, probably maybe you've seen what Chrissy Farr wrote. We're hoping to have her on to talk a little bit more about her perspective about some things that VC shouldn't fund and creating value. Like, it's a weird time to be sort of a health tech company. No, I mean, Kat is obviously hoping for everyone's downfall, to say, but like, I'm hoping
I just want the strongest to survive. Listen, you can make it through long cold winter.
Yeah. How do you feel about being in that, like in that landscape? Obviously, while we're just successful in your first raise and you're in that growth phase, I understand a bit about it. Kat and I have both been there at different times in similar situations. Like, how are you feeling about the current landscape for this? It seems like, it's pretty tricky.
Yeah. I mean, the truth is we wouldn't have been able to do this 5 years ago, even 3 years ago, because the dollars just were not there. And so with most big things in healthcare, it comes from regulatory change. It comes from folks that are, at the end of the day, the reality of how payers make decisions at the highest level is they go, what boxes do I need to check so that I can remain a plan next year? Right. It's compliance. So, that's the conversations they have in boardrooms. That's the conversations the CEOs have, when you think Q3, Q4 of this year, they're saying, what do we got to do next year so that we look good? And we're like, we're compliant. We look good from what the state needs so that we don't get dropped out of network 4 years from now. Right. And so, so from that perspective, that's like kind of where I the big lesson for me in all this was like, we're following regulation. We're going, what is regulation saying? And it just so happens that there's like this really nice alignment, right? This unique point in time where the regulation is saying, hey, push on, community-based care models work. Here's dollars, go do it. And, not just optionally go do it. Like, no, you have to go do it. And so there's buying decisions being made by the health plans, which is always kind of the biggest struggle. Is like, how do you get paid for this stuff?
Yeah, right. Absolutely.
Yeah. So overall feeling good, but like it's because of like the particular regulatory environment that we're in right now. Like I said, wouldn't have been possible a couple of years ago.
And one more question for you, Neil. So, Lisa and I both, we love Medicaid, and, we both have worked, like she said, kind of at separate times in companies that were funded well, despite being in the Medicaid space. And that's unusual, right? Because I always complain about Medicare Advantage, how we're not just flinging around dollars across the whole country. Medicaid's harder. So like you said, you're following, regulatory progress. And I didn't know, I was like, wait, am I on mute? But it's still hard. So I'm super encouraged, one, that you all are doing well, and you're getting a lot of attention. But what was it still, did you feel like it was still dramatic, or do you feel like there's just so much awesome activity in this space that it helped?
This is not for the faint. It is still hand to hand combat. It is
Yeah.
hard. Do not it creates an opening, right? But it's not like these things are handed to us by any means. It is incredibly persistent. It's also because I think a lot of these, there's been fraud and abuse, but there's also been just a lot of false promises in Medicaid, right? Folks have said all
Right.
sorts of things. They get a network, and then it doesn't work out that way. And plans are really skeptical, but most importantly, patients are really skeptical, right? There's a ton of scams for Medicaid beneficiaries, and tons, right? So when you're calling someone out of the blue, or you're texting someone out of the blue, the first instinct, I would have to be like, what do they want?
Who
do
are
they want
you?
money?
Why?
Who are you?
Right.
Do you want money? And navigating that, navigating the trust building is the hardest, which means you need to approach things softly. You can't the hardcore pharma tactics of coming in, locking you into prices and or long-term contracts. That stuff, don't do that. That's not showing good faith. Right. We are, everything from our contracting structure to when we originally meet with organizations, we offer education. We say, hey, let us tell you about what we know about the state of the world right now, and you can run the program on your own. We'd be happy to support you doing it. But if you choose not to, we're here to help. Right. And this is what it looks like. So it's and that culture, that value of trust building needs to permeate the entire organization. Right? It's everything from the first time you have your network development team to your implementations team who's working with the staff at these organizations to then your care team, right? There's just has to be so much, you have to be so cognizant that trust is the currency here. That's what matters most. And without that, everything else doesn't matter, right? It's all floof without the engagement and the trust of that community.
Weird. Trust matters. That's what I keep saying, Kat.
Right?
Weird.
Who would have thought?
I know. Well, but I don't know if you know this. You can build trust through dashboards. I didn't know if you guys know that. So one shout out from the Peanut Gallery, our great friend Tom Novak, one of our loyal followers and regulators says, "Oh, regulators are the hero of this story," in all caps. So would it appear in this case, maybe they were a little bit on the team. Maybe victory has 100 fathers and failure is an orphan. So that's awesome. And Neil, I would say, to those who are faint of heart, they can go build an AI-based risk adjustment tool for Medicare Advantage plans, and everybody's gonna be happy. Everybody's gonna be happy. So thank you.
There you go.
And I think they can donate some of those Medicare Advantage profits to Medicaid, as far as I'm concerned. If they want to just give back, they can just donate to Medicaid, give us some of the money to reinvest in communities, please.
We'll see. Well, Neil, thank you for joining our ridiculous talk show and bringing some legitimacy here. We appreciate it. We actually have two more legitimate guests, and then we have one who is on the edge.
Oh my
God. Neil, we'll leave you, and we will turn it over to two representatives from the Realness Project. So we have Laurie Lazar, who is I always get this wrong because, I'm a baby nonprofit, executive director or CEO, I don't know, of the Realness Project, and Melissa Danino, who actually works with Incenna, but is donating her time for her passion project and working alongside Laurie. So they'll explain this picture in a minute here, but here are these wonderful people. I probably should have had them up while introducing them. Actually, I don't know if it's switched or not.
Hello.
Melissa's in the green, Laurie's in the blue. Welcome.
Hi. Yes. Can you hear me?
Yes.
Yes, we can. See,
just making sure.
Laurie, say something. Oh, no. She might be on mute.
We don't get you.
Hold on.
You're. Melissa is
There we go.
a great
That's better.
New Jerseyan. That's what I can say about her. She's fantastic. Represents
Thank
the
you.
great state of New Jersey, as Kat would say, very well. Probably the best thing, and that's not a huge competition, no offense. Best thing to come out of New Jersey in last couple years here. Great.
I mean,
Top
for me
notch.
anyway.
Not a lot.
well,
Very.
y'all. So, Lori, I would love for you to introduce yourself and give a better intro than I have, and tell us a little bit about the Realness Project, which I feel like is a good. This is a good transition from our Medicaid conversation.
It sure is. It sure is. It's really exciting what's happening right now. The possibility of, like what Neil was saying, it's just so hard to figure out how to fund these things, and so you never know. Maybe this can help us as well, because we are serving people inside of prisons mostly. Our mission is to really create safer communities, both inside prison and outside prison, because they're completely linked to each other. And if we have people living inside prison that are like playing, just living by gang rules and the convict code inside and playing all these crazy games, and then coming out here and trying to like live a normal life all of a sudden, it just really doesn't work. And we've got 2 million people living behind bars today. So it really does impact our communities, our homeless communities, our addiction communities, our, all the violence and crime, and our generational cycles of incarceration. So what we do is we bring in workshops into prisons, and we work with people, on communication, relationship, conflict management skills, on, relationship with themselves and with each other, and creating community inside so they can come out and have fighting chance to create community outside. So that's what we do.
That's amazing.
Yeah.
I think it's important to note that if incarcerating people made us safer, we would be the safest country in the history of the universe, world and universe. We'd be doing so great.
Definitely.
Sadly,
it's so true.
We'd be so safe. Wow.
So true. And I'm so grateful that we've taken a wonderful woman out of New Jersey, and that is Melissa's come with us twice into prison, Colorado. And so it's amazing to have you come out, Melissa, and spend your time in prison. Yes.
I appreciate That's what I do. I go out into different states and go spend my time in prison. No, I have been lucky enough to work for Nzena, and they are amazing and allow me to work 10% of my time dedicated to a passion project. And my passion project has been healthcare and justice involved individuals. Specifically because Medicaid is not provided in a timely manner. And those individuals are then released and receiving Medicaid sometimes as little as 7 days prior to release. In Colorado, it is 14, a little bit better, not great. And if, obviously within those 14 days, they're getting their care coordination, they're supposed to get prepared to go see a behavioral health specialist, substance use disorder, get their prescriptions. And obviously 14 days in a regular, perfect setting is hard enough with the Medicaid population and people getting Medicaid in such a short period of time and then being released into regular everyday life without cell phones and things like that. They're obviously going to slip through the cracks in some situations. And unfortunately, that's probably going to be a direct reflection into them being brought back into the system. And ultimately, the 1115 waivers that are out there now, there are 2 actually within Washington and California, and there are 14 other states that are right now pending. It would be great if they actually approve so that, people can actually benefit off of this. But Lori's program and company directly reflect and correlate that work. There's habilitation within the system. It's allowing them to have interaction and communication skills, and then being able to be released into the setting and be able to continue that further on. So it's been a pleasure. And that picture that you flashed up on the screen before, Kat, I don't know if you want to put it now because it's probably a good time. That picture is an amazing photo that was taken. And I don't know if you can see, but Carrie Pie Coach is in there sitting right next to me. She sits on the board of directors and introduced me to Lori and this amazing project. And this was right after they had graduated and received their certificates. And it was a great day. It was food and poems and quite an interesting day for me to be able to participate in. So thank you, Lori, for allowing me to tag along.
And
Awesome.
kudos. This is Carrie in the background. I just want to say, it was incredible to see the program, and I've never been in corrections. Was really scared, but Lori and Melissa really held my hand through that, and many of the individuals that were there remembered Melissa. She's unforgettable, and we're
Unforgettable.
appreciative of her coming back and just making a safe and warm place for them to talk about their lives and their kids and aspirations. And some were getting out, and she brought that, New Jersey energy
Yes.
in this
The sass.
place that is just like very much appreciated for those that are working on being better individuals and better, to their family. So just want to recognize you for that.
Thank you.
Awesome. So Laura, like you've heard us talk about, right? Love Medicaid, love finding solutions to hard problems, and we love what you guys are doing. And again, thank you to Carrie for originally calling out your organization to us and bringing Melissa in. What's the why behind? I mean, starting a nonprofit is like hard, right? Raising money is hard. All these things are hard. What's the why for you?
It's a good question because I didn't really have any connection to like prison or anybody. Didn't know anyone in prison. My sister's a criminal defense lawyer, but that was about the closest I had connection to this. But I'd always been curious about relationships and intimacy and had enough trouble in my own life to like make it work, right? And I found this word called authentic relating, and it was like such a dumb name. But anyway, it was like studied it for like a whole year. My husband got into it because he saw the changes in me, and it really impacted my life. And I started out in tech, actually. I started in health tech a long millions of years ago, coding COBOL back in the day with Anderson Consulting. And it's been a long road for me. But then I got my master's in education along the way, and I did some teaching. And somehow I saw this opportunity. I saw a movie about a prison program, got online, and I started co-facilitating a class at the Boulder County Jail. And we were able to bring this authentic relating work to like distill down the 6-month program I did down to 2 days and brought it into the Boulder County Jail. And the first day there was a guy who had tats like head to toe, even on his eyelids. I'd just never seen that before. And he said, I've done therapy since I was this high. I've done every single program I can get my hands on. And this is the first day I feel like something's gotten into me and I have this whole new possibility for my life. And that's how I felt doing this work too. And I was like, oh my gosh, this is amazing. And then the second day of the program, there were guys that have been in and out of the system for 10, even 20 years. And they said, there's nothing like this in here. This is what we need. Please bring this everywhere. And so that was sort of like the day I got my marching orders. I finally felt motivated enough to make some cold calls that I'd been wanting to do with recruiting business. But anyway, I started calling prisons and saying, hey, we've got this program. Can we bring it in? And I was partnering with the sister organization called Authentic Relating Training International, authenticrelating.co. And that's the public version. Like if anyone wants to do this work on the outside, it's amazing. They do it all over the world. And they've helped us, supported us and actually trained people to help bring in. And I got trained through them. And it's just been really beautiful. And the men and women inside have been just so incredibly grateful. I could share one quick story if you want to hear a story from,
yes, please.
Okay, cool. So I'll share a story. So there's a guy named Tyler. He was 22 and he was in prison and he'd been in juvenile, and he's the kind of guy that's like, yeah, my dad's in this prison, my mom's in that prison, like his whole family's in prison everywhere. And he did one of our first programs at a very rough prison, and then he earned his way to a more minimum facility. And we went in there to do a program, and he said, Laura, you don't understand what happened after you guys left there. He's like, you did that 2-day program called The Art of Being Human. And he said, in that program, there were 3 shot callers in that room, which means those are the guys that lead the gangs while they're in prison, mostly along racial lines. And he said, it was a time where race relations were really, really building up, and we were about to have a big brawl. And because I'm one of the youngest guys, I would likely be called out to participate. And so he said, after your program, those 3 shot callers went out to the yard, and they created a new context for all of us, hundreds of guys on the yard. And that brawl didn't happen. And he's like, I'm grateful because I'm a dad and I'm a brother and I'm a son, and I'm here to tell you that, I'm just so grateful for your program.
Wow,
And
that's awesome. That's amazing.
yeah, and one of those shot callers, his name is Christopher Mountjoy, and he now lives in Colorado Springs. He's out. He's doing really great. And when I talked to him about it, I'm like, what was the context you created? And he said, we created communication before violence. And we do this whole piece about creating context and how the power of creating the context of your life and how important that is, and how much if we can recognize the context we're living in, and we can play the game better, you know? And so, yeah, that's just one story. I could share so much more, but I know we don't have.
And that's incredible. That's incredible. First, Lisa and I like having guests in the show who do stuff, right? Who like take risks and
do actual
believe in
stuff
something.
on the ground, working with people.
Oh my Lord. This is incredible, right? We've had a lot of people on the call who do stuff, including Kiri, who is listening always on the ground, right? For the dirty dirt. But, our next guest too, like people who are doing stuff, who are putting themselves out there and getting things done. And this is incredible. Where can people go who want to learn more about your work? And we'll put it in the show notes for tomorrow too.
Okay, great. Yeah, just realnessproject.org. You can go there, and there's a tab on the top that says The Ripple, and you can join the Ripple of Human Connection for just $10 a month. Supports one person to do the 2-day program. And, of course, that means $100 a month supports 10 people. So just doing the little math here for everyone.
Love it. And I appreciate the math because that's not my jam, but that's awesome. Love it. And I think that, this aligns with all of what we talk about, right? How do we support the underserved? How do we support people getting more involved in their communities? And obviously we all want to reduce recidivism and support the justice involved population. So Lisa, any parting words before we?
No, I would just say this is a call out to everybody who's in healthcare and health tech innovation. Like, this is an area that obviously needs more support. The Realness Project is doing this work on the ground, and you can support them. You can support them financially. You can also support them by figuring out the broader context of connecting Medicaid technology to supporting people in the justice system broadly. And, as Lori stated, getting people on Medicaid sooner and faster and having those connections made helps with recidivism and helps make everybody safer. So thank you all for your work. I really appreciate it. And it's great to hear the stories and hear from you all. Thank you.
Yeah, and let us know when you're coming back to give us the updates.
Yeah.
Awesome. Thank you guys.
All right,
transitioning to our next guest, our last guest of the show. We may or may not have time for the Mighty Eagle question. I don't know, because I do love talking to Peter. Peter Scharosch. I say his name correctly because I know how to say it. We won't even spell it for you guys. That's why we didn't have it up here. But this is Peter Scharosch. He is a big deal at Becker's Healthcare. I met Peter years ago. I may or may not have had too much to drink the night before at Hims, and he let me sit down during our meeting. So we became immediate best friends. Peter, introduce yourself better than I did, and then
I mean, pretty much did a great job. But yeah, Peter with Becker's, I feel like Becker's is like the day job. And I know what we're getting to is what I do outside of the office, which tends to be a lot of running and active stuff and community stuff around that. That's me in a nutshell, I would say. Everything kind of stems from probably those two things.
Okay, well, let me introduce your in-between job, because it's probably not nighttime. It's probably like dawn, dusk, and all that, as many passion projects are. So like we just said, we love people who do stuff over here. And I'd say, like, probably since I met you, Peter, every year I see some like ridiculous fundraiser you're doing to support finding a cure for pediatric cancer. And it's usually you almost killing yourself. The one I remember the most is the 7 marathons in 7 days, because I actually didn't know how that was logistically possible to like get to that many marathons. But you've raised a lot of money, and tell us why you do this, and tell us about your newest endeavor, which is pretty ridiculous.
Yeah, so I feel like I'm similar to Neil in the sense that like I went to school, thought I'd be a doctor, plans changed, like second semester, senior year, classic fashion when I have like existential crisis. So I made a little bit of a shift, went into healthcare in the tech space, and then ended up at Becker's and been there for like 7 years now. But in trying to go to med school or thinking I wanted to go to med school, I think I probably would have gone into peds for no reason other than the fact that like I think cancer is ruthless and seeing kids with cancer is a tearjerker. So I know I want to do something to give back. I just didn't know necessarily how, if it wasn't me being naive back then, what that would look like. So I think as I started to get out of college, I've done something like every September, which is Pediatric Cancer Awareness Month, just to raise funds and awareness in some sort of fashion for that. And then I picked up running after college. I was never a runner. And then slowly but surely, I pushed my own envelope in terms of like what I could do to raise money and funds for that. So started out going from like a 5K, like similar trajectory as most people, like barely running, to then getting in more and running, and then not knowing when to stop running is where it's come to. So I've done like 7 marathons, 7 days, like Kat said. I ran from Chicago to Michigan. I've done a 100-miler. And then this year on December 9th, I'm running from San Diego to Los Angeles, 125 miles to raise money for Benioff Children's Hospital out here in San Francisco.
Nice.
Amazing. Amazing. So if anyone would like to donate to Peter's latest trying to destroy himself to save lives effort, they go to, I mean, you're all over the social media. They can go to your LinkedIn.
Go to my
else can they find things?
LinkedIn.
And we'll post it.
Yeah, go to my LinkedIn. There's stuff on that. If you're on Instagram, there's an account called Run SD2LA. That'll have info on that. There's also my personal page. There's a GoFundMe page, which I can share with you, Kat and Lisa, after this. It has all the information that you might need, but various ways, probably LinkedIn, Instagram would be the two best ones.
Awesome.
Yeah, I understand sort of vaguely how one does this. Unfortunately for me and like my joints, I have run a marathon before. It was very slow. It was very bad. I don't recommend it for me. For you, sounds great. I've also ridden my bike from SF to LA back in the day. I was a tween as far as I can tell. So I have a tiny sense of like the commitment that you're making in terms of like your own body, your time, the grit involved. And I mean, thank you, because I certainly could not do it. Appreciate it.
And if you are like me and Lisa and are not going to do this kind of physical activity, but you still want to be part of the cause, you should donate to Peter's campaign. We'll post it in the recap for tomorrow. So thank you, Peter. You're awesome. Thank you for helping
Peter.
us save America.
Good luck.
One piece at a time. You rock.
Appreciate you.
All right, Lisa, I really want to read the Dear Mighty Eagle letter and use our last 2 minutes for that.
You have like 2 minutes. Go.
Okay. I'm going to read it really fast. Okay. So this is maybe this is a smash together of a few different requests that we get. Dear Mighty Eagles, I hate my job at this big company. I want to be cool like you two. I'm also very interested in this thing called equity. I need to make $450,000. I want 2% of this company that I'm going to join, and I can only work from 9 to 5. Oh, I don't fly. Lisa, what advice do we have for these people? Because there are so many people who ask this question.
Give up. Stop. Like, you can't.
You should stay where you are.
Can't be done. Stop. You won't get it. I don't think people understand how little equity people actually get. Like, even the CEO of like a VC funded like health tech company, for example, it's not like sitting on 2% of equity. That's not going to happen, my friends.
Oh my
God.
Not gonna happen. Oh my God.
No.
And if that company makes it and has an exit that's good, which is a very small percentage.
Yeah, you're talking the rule of thumb. No, the rule of thumb back in the high days was like new house, new car, new life, and new car, new house, new life in that order. It depends on how fancy your car is, I guess, your house. Those days are over. You still have to work hard if you want to get things, and unfortunately, in these areas where you have to sell and grow, you do have to get on planes again, unfortunately. I mean, that was the best part for the terrible pandemic that destroyed our lives, our country, and our world, was we got to be on Zoom at home. It doesn't really work anymore when you're trying to build something, as far as I can tell. So no.
Don't do it. No. Don't do it. I mean, do it. Do it. Just know you're not going to make $450K, work 40 hours a week, and never go on an airplane. It's just not. That's just not going to happen. So now everybody knows our answer to that question. You don't have to ask us anymore. Here we are.
No.
Congratulations.
No.
A+. All right. Okay. So we're out of time. That was great. I really liked that question. So I'm glad we got to it this time. But
another amazing health tech talk show, Kat. Spectacular.
It was incredible. I'm so glad that we worked so hard. We actually do a great job curating guests, I will say. Nicely done for us. A+.
That's all we do. That's all we do. That's all we do. There's no other preparation, obviously.
Welcome to our Google Doc. This is it. So thank you to our wonderful guests. You were amazing. Thank you for legitimizing our talk show for us. Not sure we could do it without you.
Totally.
All right.
Thanks, everybody.
Till next week.
Yay.
Till next
Bye.
week. Thanks, everybody.